Migraine headaches can certainly ruin your day, and June is Migraine Awareness Month. That's the topic for our Ask the Doctor segment. Dr. Hector Caballero from Brookwood Baptist Medical Center here to take your calls. Give us a call right now with your question, 741-9272. And just to get us started, how do you know if what you're feeling is a headache or is a true migraine?
Correct. Migraine is mostly a progressive pain, very disabling. It's associated mostly with nausea, vomiting, confusion, disorientation. It's a progressive pain, and it's important to differentiate from a regular headache that the migraine is disabling, and it's progressive. It's not a thunderclap headache. It progresses with the day.
Okay, so that's the difference. We do have a caller who tried to call us a moment ago, but we lost her. But we do have her question. Yvonne from Bessemer was asking, she had been diagnosed with an aneurysm, and the doctors told her they wanted to let it grow more before they clotting it off. Does that make sense to you? Could that have caused a headache?
Well, a headache caused by an aneurysm is not a migraine. Migraine is a different phenomenon. If you have an aneurysm, it's a vascular problem with the vessel becomes weak and expands and can compress structures, can create problem with your vision, it can create other problems. An aneurysm usually that requires surgical intervention should reach 10 millimeter or 1 centimeter. When to coil an aneurysm or when to clot an aneurysm is a discussion they have to have with the neurosurgeons at different schools. People with 5 millimeters aneurysms being coiled or being clipped. Some other doctors prefer.
But it is not a migraine.
Correct. A headache generated by an aneurysm is not a migraine, but you can have a migraine and incidentally an aneurysm has been found.
Okay, so she needs to follow up with her doctor. We have another caller, Gary, I believe, from Birmingham.
Jerry.
What's your question?
Hi, it's Jerry.
Jerry, yeah, Jerry, go ahead.
I suffered from migraines in college as a result of a really bad accident that I was in. And they went away for a long time, but I recently had a case of the shingles, and now I'm experiencing migraine-like symptoms again. I was wondering if it was migraines or if it could be post-herpetic neuropathy.
Well, a post-herpetic neuralgia cannot cause a migraine. Migraine is more of a genetic-based type of headache. It's more universal. A herpes neuralgia can aggravate a migraine, can foment a migraine. It's very difficult to define, but any facial pain, any sinus pain can progress and trigger a migraine as a consequence, but not as a cause.
So, well, I often we have another caller, Mary in Inslee. Mary, what's your question?
Yeah, I wanted to ask the doctor about. I've been diagnosed as having ophthalmic migraines, and I really don't know much about them. When I was diagnosed, I can look at a wall, and a certain portion of it, it's just a blank space, and I was wondering if there's any special risk that I should know about those type of migraines.
Correct. And ophthalmic migraine is also called retinal migraine. And people complain of behind the eye headaches. They have visual aura. They see stars, and they see her vision can be distorted during the headache. It's a type of migraine. The risk, it depends your age and depends what other comorbidity you have. If you have hypertension or risk of coronary artery disease. Migraines are related. Actually, migraines is one of the most important causes of stroke age below 40. After that, the incidence of stroke and migraine is very limited. But if you have any other comorbidity, yes, a migraine can be something that can complicate it.
Let's talk before you leave. There are things you can treat a migraine with, and are there some new things on the market to help treat a migraine? New approaches.
Correct. The way I look at a migraine is a personal phenomenon. I mean, people believe it's the same. I see migraineurs that have mild headache, severe headache, disabling headache, hemiplegic headache, the people cannot talk or walk, they look like a stroke. So my approach is people talk to the doctor, and there are many medications from antiepileptics to antidepressant to non-steroidal. It's just an enormous level of medication you can use for a migraineur, but it has to be a personalized treatment.
Okay.
There is not a cookbook for that.
But don't just suffer. Go
Yeah.
talk to a doctor and get some help.
And don't let it build because they are very disabling.